We will be talking about the scapular anastomosis and the anastomosis taking place over the acromion process. So this we can see is the subclavian artery, and the anastomosis around scapula is formed between the first part of subclavian artery and the third part of axillary artery. So uh, this over here is the third part of axillary artery, and this over here is the first part of subclavian artery. So the branches given off from the first part of subclavian artery goes like behind the scapula, like this, in this way, and the branches from the axillary artery, the third part of axillary artery, go in front of the scapula like this, and these two anastomose around the scapula. So what is the advantage of this vascular anastomosis? The advantage of this vascular anastomosis is that if any circulation gets blocked, say if subclavian artery or the axillary artery circulation gets blocked, say due to anything, due to thrombosis, or due to an embolism, or due to dislocation of the shoulder joint, so the other anastomosis, so the anastomosis can draw its blood supply from the other artery and can maintain the circulation. So this here is the shoulder joint. So in shoulder dislocation also, this shoulder joint can dislocate anteriorly and can compress the axillary artery, and in that case the circulation to the scapula coming from axillary artery can get compromised. In that case, what can happen is that the circulation can come from the first part of subclavian artery like this. So now we will see the first part of subclavian artery. So this here is the first part of subclavian artery. I'll zoom in to get a better view of all the branches. So this part over here, you can see it is ascending through the transverse foramina of C6 vertebra. So this here is the vertebral artery, and this artery over here descending into the thoracic cavity is the internal thoracic artery. So this is the vertebral artery, this is the internal thoracic artery, and these two arteries have no role in the formation of anastomosis. I just mentioned to orient ourselves to the branches of the vertebral, to the subclavian artery, and this artery over here is the thyrocervical trunk. So this branch over here is the thyrocervical trunk, and we can see that the thyrocervical trunk is giving off one branch which is going superiorly. So this is the inferior thyroid artery, and it supplies the thyroid gland and it anastomoses with the superior thyroid artery. So this here is the inferior thyroid artery. So this here is the inferior thyroid artery. Then we have a transverse cervical artery. So this over here is the transverse cervical artery. So it is traveling transversely and in the cervical region. So its name does make sense that this should be called the transverse cervical artery, and one branch arises from the transverse cervical artery which descends down over the scapula dorsally. So this is the dorsal scapular artery. So this branch over here is the dorsal scapular artery, and if I rotate the model, you can see that it is traveling dorsally over the scapula. So this artery arising from the transverse cervical artery traveling like this is the dorsal scapular artery. So our the subclavian part of the anastomosis is being formed by the dorsal scapular artery. Now it's the turn for the axillary artery to give its contribution to the anastomosis. So this over here is the axillary artery, and this is the anterior circumflex humeral artery, as we talked on our video in the branches of axillary artery. This is the posterior circumflex humeral artery, and this here is the subscapular artery. So this here is the subscapular artery. Now the subscapular artery further gives off branches. So this branch over here is called the thoracodorsal artery. So this was the subscapular artery being given off from the third part of axillary artery, and this subscapular artery gives off a branch which is known as the thoracodorsal artery, and this name also does make sense since it is traveling dorsally and over the thoracic cavity. So this thoracodorsal artery anastomosis with this artery, and this artery was the dorsal scapular artery. So this artery is the dorsal scapular artery, and dorsal scapular artery was a branch of the transverse cervical artery. So this here is the transverse cervical artery, and the transverse cervical artery is the branch of thyrocervical trunk. So this completes our scapular anastomosis. Now we will take a look at the anastomosis over the acromion process. So this artery was the dorsal scapular artery, but along with this a suprascapular artery is also given off by the thyrocervical trunk. So the suprascapular artery is currently being shown. So this is the suprascapular artery, and the suprascapular artery anastomosis with the acromial branch of posterior circumflex humeral artery. So this here is the posterior circumflex humeral artery. Now the posterior circumflex humeral artery gives off an acromial branch which ascends like this upward, and it anastomosis with this suprascapular artery. So this completes our video on the scapular and the anastomosis over acromial joint.